If you're studying for the DANB GC exam, four-handed dentistry and instrument transfer is guaranteed to show up. That's why we're covering team dentistry, operating zones, grafts, transfer techniques, straight from the MDA 15th edition textbook. Hey DA besties, it's your girl Leela. You already know. Welcome back to
the DA Study Spot, yeah.
Today we are breaking out Chapter 33, Delivering Dental Care. How the dental team actually delivers care in the chair, and how every motion you make either helps or hurts the efficiency. So grab your pen and notebook and let's get into it. But before you do so, be sure to hit that like, subscribe, and notification bell so you are alerted every time I upload new study sessions. Run it! Team dentistry, also called four-handed dentistry, is the concept where the dentist and the dental assistant work together to perform clinical procedures in a streamlined, ergonomically structured environment. This concept was introduced in the 1960s and was built around one goal: deliver the best, most efficient care while reducing stress and fatigue on the team. The basic goals of team dentistry are: use ergonomically correct dental equipment, use preset trays for procedures, minimize stress and fatigue through specific positioning of the patient, dentist, and assistant, follow the principles of motion economy, use moisture control to keep the field visible, delegate expanded functions to the assistant legally within what the state allows. Research has actually shown that when a skilled chairside assistant works with a dentist in this format, it eliminates a huge percentage of unnecessary movement and meaningfully boosts productivity. That's why this isn't just nice to have. It's a backbone of an efficient dental office. Motion economy is how efficiently you conserve energy while doing a task. And this matters for your exam because motions are classified into 5 categories based on how much of the body moves. Starting with class 1, which is fingers only, so think picking up an instrument off of a flat surface. Then class 2, which is fingers and wrists, placing or receiving an instrument with a pen grasp. Then you have class 3, which is fingers, wrists, and elbow, so transferring an instrument to the operator from the tray. Then class 4, the entire arm and shoulder, reaching for something in the mobile cabinet. And then class 5, the entire upper torso, bending over to grab materials from a drawer. So the goal in four-handed dentistry is to eliminate class 4 and 5 motions wherever possible. Those are the ones that cause lower back pain and fatigue over a career. This is the clock concept and it is 100% testable. Picture a clock face laid over the patient with the patient's face at the center and the top of their head at 12 o'clock. For a right-handed operator, the operator zone is 7 to 12 o'clock. The transfer zone is 4 to 7 o'clock. This is where instruments are exchanged right over the patient's chest. The assistant zone is 2 to 4 o'clock, and the static zone is 12 to 2 o'clock behind the patient's head where equipment and supplies live. But for a left-handed operator, these zones flip. Operator zone is 12 to 5, transfer zone 5 to 8, assistant zone 8 to 10, and static zone 10 to 12. Know both directions. The exam won't always assume right-handed operator. There are 3 basic instrument grasps. First is the pen grasp, which is held like a pen and used for most operative instruments. Second is the palm grasp, which is held securely in the palm, used for bulky instruments and hinges. And third is the palm thumb grasp, which is held in the palm with the thumb stabilizing and guiding it. It is used for instruments like an oral excavator. One exam favorite detail: the mirror and the explorer are both delivered together using a two-handed exchange. For a right-handed operator, the explorer goes in the left hand and the mirror goes in the right. These are 2 important key terms you should know. A fulcrum is a finger rest that stabilizes the hand while holding an instrument or handpiece. When it's positioned inside the mouth, it's called an intraoral fulcrum, and it should be on the same arch, ideally the same quadrant you're working in. Indirect vision means viewing the tooth through the reflection in a dental mirror instead of looking at it directly. It takes practice because the image you're seeing is reversed. And that's your Chapter 33 breakdown. Team dentistry, motion economy, operating zones, grasp, and transfer technique. All exam relevant, all from your textbook. Chapter 33 also covers the exact clock positions and vision types for every area of the mouth: maxillary, mandibular, right, left, anterior. That's actually a full table in your textbook. And it is exactly the kind of specific detail the GC loves to test. I break that entire table down in my Ultimate DANB Certification Study Guide, along with 375 plus practice questions. That way you know what to expect on exam day. Links in the description and pinned in the comments. If you found this video helpful, be sure to hit that thumbs up button, subscribe, and share with a DA bestie, and I will see you both at the next study session. Bye.
The DA study spot, yeah.